Hello, my name is Heather. I'm a registered nurse, a sickle cell warrior, and a proud volunteer of the Advancing Sickle Cell Advocacy Project, better known as ASAF, Be Informed. Today, I will be doing a short presentation entitled Sickle Cell Anemia 101, Understanding the Basics. What do we know about sickle cell anemia? We know that it is inherited as an autosomal recessive trait. Hereditary or inherited means that the disease is transmitted genetically from parent to child. Autosome is any chromosome that is not considered a sex chromosome or does not determine the sex of the fetus. Autosomal recessive means that an abnormal gene or allele is located on one of those autosomes. 2 copies of the abnormal gene are required for the development of the disease. HGBA is the normal or typical hemoglobin gene. HGBS is the defective gene. The box above depicts the mother in pink, having an A and an S. She has 1 normal hemoglobin and 1 abnormal hemoglobin. She has sickle cell trait. The father's autosomes are shown in blue. He has 2 A's, meaning he has 2 normal hemoglobin. He does not have the disease or the trait. To utilize this box, if you take A1 in blue and A1 in pink and put in this box, you would have AA. If you take A1 in blue, S1 in pink and put in this box, you would have AS. Coming down, A2 in blue and A1 in pink, put in this box, you again have AA, and A2 in blue, S1 in pink, put in this box, you have AS, I'm sorry. If this couple had 4 children, 2 would have normal hemoglobin and 2 would have the trait for sickle cell. While the 2 children with the trait will not be considered sick, they can pass on the trait to their future children. Recent studies have found that persons with the trait can experience symptoms of a sickle cell crisis if their body is stressed, dehydrated, or overexerted. Athletes are at specific risk. Anyone interested in playing sports should know their sickle cell status before joining a team. In the left box, in the left chart, the mother again is in pink, A and S. She has sickle cell trait. The father is in blue, AS. Again, he has the trait. So if you take A1 in blue and A1 in pink and put in this box, you have AA. If you put A1 and S1 in this box, you have AS. If you put S2 with A1 in this box, you have SA or AS. If you take S2 and S1 and put in this box, you have SS. This time, if the couple had 4 children, 1 would have no sickle cell gene, 2 would have sickle cell trait, and 1 would have sickle cell anemia disease. This chart over here, the mother again is in pink. She has SS, or she has sickle cell anemia disease. She has 2 abnormal hemoglobin. and the father is in blue with AS, he has sickle cell trait. So again, taking A1 in blue and S1 in pink, put in this box, you get AS. Take A1 in blue, S2 in pink, put in this box, you get AS. Take S3 in blue and S1 in pink, put in this box, you get SS. S3 in blue and S2 in pink, put in this box, you have SS. This time, if the couple had 4 children, 2 would have the trait and 2 would have the disease. This is what a normal red blood cell looks like. It is concave or looks like a donut. It has a lifespan of 120 days. On the other hand, if you look at the red blood cell on the right, this is what the red blood cell looks like in a person with sickle cell anemia. The disease gets its name from the shape of the red blood cells, which looks like the farm tool, the sickle. These ill-shaped cells are extremely sticky and rigid. In comparison to the 120 days lifespan of the normal red blood cells, these abnormal cells only live for 10 to 20 days. Their early death results in the patient being anemic, which means they have a much lower amount of circulating red blood cells. Normal hemoglobin level for males is 13.8 to 17.2, and for females it is 12.1 to 15.1. Most patients with sickle cell anemia, regardless of their gender, have a hemoglobin level of between 6 to 11 grams per deciliter. To compensate for the loss of mature red blood cells, the body is forced to pump out a lot of immature red blood cells to do the work that needs to be done. Those immature red blood cells are called reticulocytes. Here we see what a hemoglobin molecule looks like. Hemoglobin is a red protein found in our red blood cells. The word hemoglobin can be broken into 2 words, heme and globin. Heme is a molecule that contains iron. Globin is an oxygen-binding protein. Paired together, the iron contained in the heme attracts the oxygen from the air we breathe. The globin then binds the oxygen, which is transported from our lungs to the rest of our body. It also returns carbon dioxide from our tissues back to our lungs. Fun fact, heme is what gives our red blood cells its color. What exactly is happening inside the blood vessels of a person with sickle cell anemia? As the blood flows through the blood vessels, the sickled cells become a clumped up ball of sticky cells. That clump then causes a blockage, which obstructs the flow of oxygenated blood beyond the point of the obstruction. That obstruction causes an infarct or tissue death. Think of a person who has had a myocardial infarct, also known as a heart attack. They suffer tissue death of the heart muscle. In persons with sickle cell anemia, we suffer numerous infarcts over time, resulting in tissue death in various parts of our bodies. There are circumstances, sometimes which are not within our control, that can increase our risk of developing these blockages, as seen here in the picture. Those risk factors are stress, dehydration, high altitude, infections, and extremes in temperature, particularly cold. The symptoms that persons with sickle cell anemia suffer from varies from person to person and from genotype to genotype. They suffer from chronic anemia, fatigue, vaso-occlusive crises or pain crises, which vaso-occlusion by definition is a blocking or obstructing of the blood vessels, which we discussed previously. They also have a susceptibility to bacterial infections, delayed growth or puberty, visual problems, specifically that of the retina. Did you know that all newborns in the United States are tested for sickle cell anemia? You may ask why. The reason is, while this disease is most often associated with African Americans, it is not limited to it. Other groups that are affected are Hispanic Americans of Central and South American descent, people of Middle Eastern, Asian, Indian, and Mediterranean heritage, and yes, Caucasians are affected as well. If a newborn's heel stick picks up abnormal hemoglobin protein, a confirmatory hemoglobin electrophoresis is done. It is advised that adults with any of the above heritage be tested. It is most important if you plan on starting a family. Adults seeking testing will provide a blood sample via an arm draw. The sample will be sent off to the lab for a hemoglobin electrophoresis to be done. When the results come back, your doctor will discuss if you have sickle cell anemia and which genotype you may have. There are over 7 known genotypes. A few of them are HBSS, HBSC, HBS, beta thalassemia, HBSD, HBSE, HBSO, HBAS. If you're a sickle warrior or the caregiver of a warrior, consider becoming involved in any of the numerous sickle cell communities. You will find support, education, and most of all, friendship. Thank you for listening. I hope you were informed.